Hi, this is Renee Holcomb. The presentation that I'll be going over today is the ways that the Advanced Population Health Nurse, or APHN, can impact some of the major issues affecting the health of rural elderly populations with cardiovascular disease. The rural areas are designated as a population of less than 2,500. Elderly adults are defined as those 65 years and older. The population that I've chosen to discuss is made up of adult men and women greater than 65 years of age living in areas with a population of 2,500 that also have a history of cardiovascular disease or risk of cardiovascular disease. There are many issues affecting the health of the rural elderly populations. The Healthy People 2020 initiative identifies some chronic conditions managed by older adults to include heart disease, cancer, chronic bronchitis or emphysema, stroke, diabetes, and Alzheimer's. These adults are often managing 2 or more chronic conditions, and they're not unique to rural populations, but they do pose different challenges in management. Alabama has the third highest heart disease death rates per 100,000. Heart disease was the leading cause of death in Alabama in 2013, so it's statistically identified as a leading cause of death in the state of Alabama. Some of the barriers faced by rural populations include a lack of insurance, transportation issues, lack of providers for specialty treatment. Some identified barriers for rural minorities include ability to pay and availability and accessibility of services. There are service deficits discussed by Kraut and Kenner, which impact the health of the rural aging population. These service deficits are broken down into 7 categories, which are availability, accessibility, affordability, awareness, adequacy, acceptability, and assessment. Now, all of these categories can be addressed by the APHN to improve health outcomes. But for the purpose of the assignment, the focus is going to be on the 3 that you see here: the availability, affordability, and awareness. So we're all familiar with the 5 sub-roles of the Advanced Population Health Nurse. They are the clinician, administrator, educator, research, and consultant. Through these various roles, we can make a significant impact on the health of the community served by improving the social determinants of health and overall conditions of living. Availability, affordability, and awareness can all be positively impacted by the Advanced Population Health Nurse. They can help to develop programs to reach the rural elderly populations. One example would be the development of a heart attack awareness program in an area that did not have cardiology services. By bringing these programs to the area in need, the Advanced Population Health Nurse makes the program available, accessible, and creates awareness through training and education of the identified vulnerable population. When discussing the availability of services, it's really a significant deficit for the rural populations, especially for older adults. Rural areas often do not have enough care providers and may not offer diverse services. When there are not enough health care providers in a given area, patients must wait to get appointments. If a service line is not offered in an area, people must then travel to the nearest available area that does offer the service. Leadership roles as managers and administrators place the APHN in a unique position to use their knowledge and position to facilitate change. As an administrator, they have the ability to influence change by leading and supporting initiatives to bring needed service lines to an area. In the administrator roles, they can also encourage the use of evidence-based research to guide policies and procedures used in the area related to the needs of the population. As a consultant, they can assist rural areas with developing plans to meet the needs of the population. This may be accomplished by recommending specialty services available a few days a month, or making them available via alternative methods such as telehealth. The evidence-based practice is identified through research, and the role of the researcher, we can help to define optimal interventions to improve the health of the population served that have cardiovascular disease or risk for cardiovascular disease. Accessibility in the rural geriatric populations can be negatively impacted by a lack of adequate, appropriate, and affordable transportation, isolations related to culture and social status, and a lack of regional coordination. When a population cannot afford the appropriate care, they can suffer. Financial difficulties in rural areas can limit access to transportation, and therefore the population does not have access to the care they need. In the administrator role, the APHN can lead efforts to provide low-cost screening in areas without adequate financial means. As a clinician, they can assist the elderly with identifying financial resources that they may not already be aware of. Awareness can also impact the coordination of care for these populations. There's often decreased levels of literacy, and educational opportunities are a significant issue in rural areas. Health literacy, we know, can impact the outcomes for any population if they're not knowledgeable of the health issues and interventions to control the issues that they face. They're not going to be able to maintain good health. Low health literacy in conjunction with other barriers to health care can lead to more significant issues for the rural populations. There are often other social disadvantages such as lower education levels, lack of medical insurance, and poverty often coexisting with lower levels of health literacy, which exacerbate the effects of these vulnerable populations. Low health literacy is associated with increased hospitalization, decreased ability to discuss how to properly take medications, and how to interpret medication labels. So we have these elderly individuals with potentially lower levels of health literacy that have poor overall health and therefore increased mortality rates. To improve the health literacy of this population, the APHN can conduct research to identify the needs of the patient. They can also review current research to determine its feasibility for implementation in their area. In the clinician role, they can address health literacy through identification of a patient's level of literacy and ways in which the patient prefers to receive educational materials. This quick assessment can be incorporated into a general interview and history assessment completed early in a visit. In the educator role, they can use their knowledge and expertise to develop education using a systematic process to guide and develop the materials. In particular, they should identify the educational needs of the individual or group, establish outcomes and goals, select appropriate education methods and materials, and implement the plan and evaluate the process. This should all be done while maintaining the dignity of the patient. So how does Roy's adaptation model fit into this population and these issues that are going on? The focus of Roy's adaptation model, or the RAM, is the adaptive response of clients to internal and external stimuli. The adaptive and the human systems are active in relation to the environment and are continuously changing. This constant shifting can lead to a loss of balance in the individual, causing ineffective adaptation. Effective utilization of RAM should lead to satisfactory and successful nursing care to prevent alterations in the adaptation of individuals receiving health care. RAM includes 4 concepts of the nursing meta-paradigm: nursing, human beings, environment, and health. According to Fawcett, the concept of nursing is represented by the RAM concepts of art and science, in that nursing is both an art and a science. RAM can be utilized effectively in various nursing situations, such as nursing research, education, and practice. Nursing practice based on the Roy adaptation model is meant to promote the effective adaptation of human beings to changes in the environment. The nursing process using RAM is comprised of multiple components, which are the assessment of behavior and stimuli, nursing diagnosis, goal setting, interventions, and evaluation. It plays a part in the well-being of the human adaptive systems by preserving or augmenting the adaptation levels and the responses of individuals, groups, or communities. The conceptual framework, as detailed, can be utilized in multiple nursing situations with optimal results for the patient and healthcare workers. So, to summarize what we've went over, the APHN has the potential to significantly improve the overall quality of care provided to the geriatric populations in rural areas. Through the identification of areas that need to be made available, they can develop programs specific to the population. Once a program is developed, it can be provided in a location that makes it easily accessible to the folks that need to attend. Through learning objectives set in the development of the program, guided by Roy's adaptation model, they can increase awareness and improve health in the population of need. By addressing these challenges, they can make a difference in the quality of health care provided to the elderly adults in this area. So our goals for the population served should always be to reduce costs, improve overall health, while minimizing the potential for poor patient outcomes related to some of the difficulties of residing in a rural area. The APHN must ensure the residents are not only educated on available resources to assist them in their healthcare journey, but they also understand what this means to them in their health.